Thank you for joining me today. Our lecture is about depressive and bipolar disorders. Mood disorders impact emotional regulation and personal function, include depressive and bipolar spectrum disorders. They require comprehensive assessment and individualized treatment. In this video, you will understand mood disorder, major depressive disorder, persistent depression disorder, grieving and depression, premature dysphoria disorder, bipolar disorder, suicidal risk, and cultural consideration. We will go over case examples, summarize the lecture, and I have a discussion questions. These are our discussion questions. How do you differentiate major depression disorder from bipolar depression? What are the key considerations in prescribing mood stabilizer? How can we reduce stigma in diverse population? I will answer this question in the end of the video, so stay tuned and thank you for joining me today. Our learning objectives: define and differentiate depressive and bipolar disorders, identify diagnostic criteria and specifiers, review the treatment options, include therapy and pharmacology, assess suicidal risk and cultural consideration. Those are our learning objectives, so stay tuned. Understanding mood disorders. Mood disorders involve disturbance in emotional state, ranging from depressive to manic symptoms, affecting cognitive, behavior, and physical health. Major depressive disorder characterized by the persistent low mood and loss of interest, affected daily function of the client and the quality of life. Major depression disorder prevalent is 17% in lifetime, more common in female. Risky factors are genetics, trauma, chronic illness, and substance abuse. Major depressive disorder diagnostic criteria are 5 or more symptoms during the same 2 weeks period, depressive mood, sadness, weight gain or weight loss, appetite change, sleep disturbance, fatigue, worriousness, poor concentration, recurrent thoughts of death or suicidal ideation. Major depressive disorder specifiers include anxiety, distress, melancholic features, atypical features, psychiatric features, and with seasonal pattern. Major depressive disorder diagnosis differential include bipolar disorder, grieving reactions, substance-induced mood disorder, medical conditions like hypothyroidism. So what are the depressive disorder assessment tools? They include PHQ-9, that assists the depression scale, DAC depression inventor, Hamilton depressive rating scale. Major depressive disorder treatments include combination of a psychotherapy and pharmacotherapy, lifestyle modification, and social support, monitoring for suicidal ideation. Psychotherapy approaches for depression include cognitive behavior therapy, interpersonal therapy, behavior activation, mindfulness-based cognitive therapy. For the pharmacology approaches, SSRIs are the first line of therapy for the depression disorders. SNRIs anti-typical antidepressant. TCAs, MAOs are the other treatments for depression disorders. Monitor the side effect of the treatment and the response of the treatment. Persistent depressive disorder is a chronic low mood that is equal or greater than 2 years. It has a few symptoms than major depression disorder, often begins in teenager years. Key differences between grieving and depression are: grieving is a wave of sadness and preserve self-esteem. So the self-esteem is not affected. However, depression is a persistently low mood and restlessness. So the client has a depression and low self-esteem. Grieving may progress to depression. So, premenstrual dysphoria disorder is a severe mood symptoms before the menstruation. It affects the function and relationship. Some of the treatments are SSRIs, CBT, and lifestyle changes. Bipolar disorder is characterized by mood swings between depression and manic. Typically, there is a bipolar 1, bipolar 2, and cyclomania. Bipolar 1 disorder is at least one manic episode. It may include depressive episodes and significant impairment or hospitalization. However, bipolar 2 disorder, there is at least one hypomanic and one depressive episode. No fully manic episodes, often misdiagnosed as a unipolar depression. Cyclothymic disorder is a chronic fluctuation mood for 2 years or more, hypomanic and depressive symptoms not meeting the full criteria. What is the difference between manic and hypomanic? Manic is 1 week or more with severe impairment and may need hospitalization, while hypomanic is 4 days, no psychosis or hospitalization needed. Bipolar disorder epidemiology and risk factors. So prevalent for bipolar disorder is 2.4% in the general population. Onset is the late teenager, early adulthood, and the risk factors are family history, stress, and substance uses. Diagnostic criteria for bipolar disorder is a distinctive mood episodes with changing in energy and activity. It has a manic and depressive phases. So manic is the elevated irritation mood with 3 symptoms or more. Also, it has depressive, same as a major depressive disorder criteria. Bipolar specifiers include with rapid cycling, with mixed features, with psychotic features, and seasonal pattern. Bipolar differential diagnoses include major depressive disorder, ADHD, substance-induced mood disorder, personality disorders. Bipolar disorder treatment include mood stabilizer, atypical antipsychiatric medication, psychoeducation, psychotherapy, monitoring for adhesive to the medication and the side effects. Mood stabilizers. Lithium is the gold standard and it has a narrow therapeutic index. Fulbrate and carbamazepine and lamotrigine are the other mood stabilizers. They require lab monitoring and side effect monitoring. Atypical antipsychiatric medications are used acute manic and maintenance. Example will be Seroquel, olanzapine, lorazepam. So they require metabolic monitoring side effects such as increased appetite, weight gain, nausea, diarrhea, GI symptoms. Psychotherapy for the bipolar disorder include psychoeducation, CBT, family focus therapy, relapse prevention strategies. For the suicidal risk assessment, assess the ideation, plan, intent, and means. Use tools such as Columbia Suicidal Severity Rating Scale, high risk in both major depression disorder and bipolar disorder. Cultural considerations. Cultural expression of a mood symptoms may vary. Stigma may affect to seek help. Use cultural adapted assessment. Case example 1. You have a 40 years old with fatigue, sadness, and guilt. You will use PHQ-9 and you score 19, which is moderate to severe. You have to start on SSRI and CBT. Case example 2, you have a 35 years old with mood swings and impulsive. You diagnosed it with bipolar 2, and then you have to start with mood stabilizer and psychoeducation. For summary, mood disorders include depression and bipolar spectrum. Diagnosis requires careful assessment. Treatment is multi-modal and individualized. So each person is different and patient-centered care is needed. Key takeaways. recognize mood disorders, presentation, use evidence-based treatment, monitor the risk, and cultural consideration. These are our discussion questions answers. Thank you for joining me today. I would love to see you in my next video.